You're probably wondering what I can teach you about stress, since you're already becoming an expert now that Crohn's is part of your life. Like always stressing about where the nearest bathroom is, or worrying about a flare, or will you have to have surgery? On top of the other stresses we all have just because we're human. But having stress in your life doesn't make you an expert, really. It just makes you, well, stressed. So I want to talk to you about how it can affect you physically to be stressed out and what you can do to reduce your stress. First of all, let me say that there's no evidence showing that stress causes Crohn's disease, but you probably know that already. However, living with a chronic illness can cause people with Crohn's to feel increased stress in their lives. Again, something you likely are aware of and have even experienced. What you may not know is that many people with Crohn's report a flare in their disease when they're going through a stressful event or situation. So becoming better at managing your reaction to stress would be a good idea. Now, before we get to stress reduction techniques, let me just give you some insight into what stress does to your body. Research has shown that when you're stressed, your normal digestive process changes. Your stomach empties slower and secretes more acid, which can aggravate your digestive tract. Stress can also speed or slow the passage of intestinal contents and may even cause changes in the intestinal tissue itself. Stress doesn't cause Crohn's, but it does affect your immune system, which, as you already know, is a core factor in triggering the inflammation. So you can see that stress isn't just a mental state. It involves physical reactions as well, and ones that can make your signs and symptoms much worse. So whether you've made the connection between stress and your Crohn's symptoms or not, I'm hoping that just knowing what stress can do to your body will motivate you to learn to manage it better. And remember, stressful events can take many different and unexpected forms, from minor annoyances like a noisy neighbor to bigger ones like a move, job loss, or the death of a loved one. Now, from my own experience, I can tell you that for people who find there's a connection between their stress level and the worsening of their symptoms, using relaxation techniques such as slow breathing and taking special care to eat well and get enough sleep may make them feel better. Look, I know it's virtually impossible to avoid stress, but you can learn ways to help manage it. Here are a few examples. Exercise. Now, don't get stressed out by this recommendation. I'm not asking you to become a fitness buff. Even mild exercise can help reduce stress, relieve depression, and normalize bowel function. Like walking more often or taking the stairs regularly instead of the elevator or escalator. Doesn't stop here, and if you want to get more serious, just talk to your doctor about an exercise program that's right for you. Biofeedback is another good technique, and it's usually taught in hospitals and medical centers. The idea is to help you reduce muscle tension and slow your heart rate with the help of a feedback machine. With a little practice, you can learn how to produce these changes without feedback from the machine. The goal is to help you enter a relaxed state so that you can cope more easily with stress. Then, of course, there are regular relaxation and breathing exercises. They are a simple and important way to cope with stress when you do them on a regular basis. Now, I'm not telling you to use this as an excuse to become a couch potato, but I am recommending that you build relaxation into your busy routine. Yoga and meditation are a couple of great ways to slow things down in your life, which can involve taking a class or using books, CDs, or DVDs at home. But don't take my word for it. Check out Kevin, an expert relaxer, and find out what he does to help shut out stress when it shows up at his doorstep.
Hi, my name is Kevin, and I work as a chaplain at the University of New Brunswick. I'm extremely active, as you can see, and I've had Crohn's all my life. I consider myself a pretty regular guy. I have my ups and downs like anyone else, except that my downs sometimes include a flare-up of Crohn's disease. But you know all about that. I've had Crohn's all my life, so I never had the shock of a diagnosis. That was for my parents when I was 3 months old. Talk about stressful. But like everyone else in the world, I have to deal with stress on a regular basis. And because of my Crohn's, it's important that I deal with it pretty quickly because it can have an immediate impact on my health. As a teenager, I didn't really know much about stress. Life just kind of happened. But ever since my early 20s, I've been getting more in touch with stress and how to deal with it. And I can tell you, as my plate gets fuller, my stress level gets more challenging. And so too does my level of GI discomfort. Things like diarrhea and cramps. Luckily, I'm very active, and I find that exercise can be a real stress release. But I've also learned to listen to my body more and to use other ways to take it down a notch. For instance, I do yoga, and the breathing techniques I've learned can really help when life gets too intense. Or, if I don't feel well, I don't push it. I take a day or more off from my active routine and allow my body to recharge. But most importantly, I find that building stress relief into my daily life is really helpful. I try each day to do something that takes me away from the daily grind, whether it's a walk outdoors or some other physical activity, or even just a quiet cup of tea. All I can say is, don't underestimate stress. Be mindful of overdoing it, and always listen to your body. You may not like what it has to say, but it's always honest with you. It's just another way to start to take control of your disease and your life.
Don't get stressed out, but it's time to make another decision. Will it be managing Crohn's or learning about your digestive tract? Or maybe you have another selection in mind. Make your choice.